Well, if we take the CLL, for example, which I think is one of the B-cell lymphoproliferative disorders we include, we've seen enormous changes in the landscape in CLL with the use of Ibrutinib showing very major progression-free survival improvements in patients with relapsed and refractory disease. And the question now will be how to use it first line or early in the time course, whether it needs combining with any other agent, or whether you should use other agents at time of recurrence. Agents such as Venetoclax, anti-BCL2 inhibitors, are going to be very important. So the landscape in CLL is changing, and the movement, as we've seen in myeloma, away from chemotherapy towards biologically based treatments. That doesn't mean they're not going to have certain toxicities. We've seen with Ibrutinib side effects such as atrial fibrillation and other unexpected side effects. I don't think the novel agents will be completely without side effect. Nonetheless, they'll be efficacious and applicable often to a group of patients, the elderly frail, who may not have had any other options in the past. I think in low-grade lymphoma, we're still reliant on chemotherapy, although we may see, as I present in gallium, the substitution of a novel antibody for standard treatment. I think in high-grade lymphoma, the landscape is quite disappointing. The failure of the Goya trial to show that obinutuzumab chemotherapy produced superior results is obviously disappointing, because there haven't been any major improvements in the outlook for diffuse large cell lymphoma for over a decade. And I think that's an area where we'll need to see a different approach if we're going to see improvement. I think in mantle cell lymphoma, we're seeing, again, biological agents which are able to demonstrate good progression-free survival, such as Ibrutinib. So I think the landscape in lymphoma really can't be categorized in one area. You have to look at the low-grade lymphomas, where I think we are beginning to see cracks, if you like, in the resistance patterns of disease. I think the higher grade of lymphoma, T-cell lymphoma and diffuse large B-cell lymphoma, we've actually seen very little, despite a greater biological understanding.